Ethics76 informed consent details. Imagine you are an attending physician in a surgical clinic. You have a 55-year-old patient, Mr. Smith, who needs a cholecystectomy for symptomatic gallstones. He is sitting in front of you and you have the consent form ready on the desk. Before you ask him to sign that paper, what specific components must you discuss with him to ensure that the informed consent is both legally and ethically valid, including the important disclosure regarding who will be participating in his surgery? To ensure informed consent is valid, you must have a structured conversation that covers several critical areas. First, you must discuss the diagnosis and the nature of the procedure in plain language without medical jargon, explaining exactly what the problem is and what the surgery will involve. Second, you must clearly outline the potential benefits and how this procedure will improve the patient's quality of life. Third, you must discuss the material risks, listing common risks like infection, pain, or bleeding, as well as rare but serious complications. Fourth, you must discuss the alternatives, including non-surgical management or the risk of doing nothing at all. Beyond these standard elements, if you are in a teaching hospital, you have an ethical and legal obligation to disclose the involvement of medical trainees. You must inform the patient that residents, interns, medical students, or observers may be participating in the procedure. You have to explain that while you, as the attending surgeon, are ultimately responsible for the operation and will be present, these trainees will be assisting or performing parts of the surgery under your direct supervision. This is not just a formality, it is a fundamental part of patient autonomy. Patients have a right to know who is in the operating room and what role they will play. If the patient expresses discomfort or refuses the involvement of certain trainees, you must address those concerns directly and transparently. After addressing the team structure, you must verify the patient's decision-making capacity, ensuring he is alert, oriented, and free from the influence of sedatives or severe pain. Finally, the most critical step for validation is using the teach-back method. Ask Mr. Smith to explain back to you in his own words what he is agreeing to, what the risks are, what the alternatives are, and that he understands who will be involved in his care. If he cannot explain it back to you, he is not truly informed and you need to repeat the explanation until he understands. Informed consent must be entirely voluntary, without coercion, and it is your responsibility to document that the patient has understood and accepted these terms. To summarize the essential components of a legally and ethically valid informed consent, ensure you include these key points in your discussion and documentation. 1. Explain the diagnosis and the nature of the procedure in clear, simple language, avoiding complex medical jargon. 2. Outline the potential benefits and how the intervention aims to improve the patient's quality of life or symptoms. 3. Discuss the material risks, covering both common complications like infection or pain and rare but serious risks relevant to the procedure. 4. Present the alternatives, including non-surgical management options or the potential risks of choosing to do nothing at all. 5. Disclose the involvement of medical trainees, specifically explaining that residents, interns, medical students, or observers will be participating in the procedure under the supervision of the attending physician. 6. Verify the patient's decision-making capacity to ensure they are alert, oriented, and free from the influence of severe pain or sedatives. 7. Utilize the teach-back method by asking the patient to explain the procedure, risks, and benefits back to you in their own words to confirm their understanding. 8. Confirm that the decision is entirely voluntary, free from coercion, and acknowledge that the patient has the right to refuse treatment at any time.